en inglés.
Get that out of the way. So we're gonna go to that portal for nhanow.com. And you're gonna create. You're gonna go. You're gonna have a page to log in because you do not have a login information yet. Maybe you do. I don't know if you do.
Espérate, niña, déjame ahora porque
But
están
if
dando una
you
cosa que me
don't, then
interesa,
you
que
have to
necesito hacer.
create. Um,
Yo te
you
amo
have to
un rato.
create.
Dale un besote.
So you go to this page. It says login information, email, password, and then because you do not have an account, you have to create an account. How many of you have an account because you used the NHA in the past, or anyone has an account because they used it in the past? So anyone has an account from before? Christian, Vanessa, Lane, Diley, Frank. No, Andrea.
I don't have one.
No.
I don't have one. Smartphone.
You've never used NHA before, anyone?
No.
No,
No.
me neither.
So let's do it. Let's do it like this. So let's follow this the link that I put in the chat for you guys. Go into create an account. So you have to put your information: first name, last name, email address, phone number, the password. The password requirements are going to be one capital letter, at least one capital, one lowercase, 8 digits long minimum, a special character and a number. So kind of like 3 things. Make sure that you put the correct billing address. Billing is not that they're gonna bill you anything, but your billing address is where they're gonna send you your certificate when you finish. So when you finish with the NHA, they're gonna send you a certificate to an actual printed certificate to your address, and that's the address that they're gonna send it to, whatever you put there. When it tells you if you are registering as an individual or through school, select school, and also make sure you select the right school. In your case is Hialeah MBC campus. Okay, let me put the link again here for Martha. There you go. It will tell you when are you planning to take the exam. Remember, you're planning to take the exam around the 5th, I think that's what we said, 5th or 12th of August, any of those two. So you could put August, so 8/5. 8/5 or 8/12. Please let me know when you
Do we put the school email or not? We can use our personal email.
you could use the school. I rather you guys use you should use the school email. You should use the school email. Yeah. You can always change it if anything.
Professor, you remember I don't have access to the email for the non-credit course. I mean, I do have access to the actual Miami-Dade, like the regular credited email. That's fine.
Yeah. Like if it ends with mbc.edu, you could use it.
Yes.
Remember, the school pays for the exam, so in order for them to verify you as a student, you have to be with that. So yeah, those are good questions. So as you are completing it, please let me know that you completed it, so I can do a check mark in your thing here.
I'm still looking for my school email.
That's okay. What your school email will be on Canvas also. Like if you go to Canvas, you have your, because you have, when you go to Canvas, you go to account, and profile, you have your information there. It should be there.
Okay, thank you. Let me try this one.
Teacher, in organization information, I put the school, no? School?
Yes, so
Okay.
put Hialeah MDC.
School or employer, school or register, school, school.
School, yeah, school, it's the same thing.
Okay. And organization?
Then look for Hialeah MDC campus.
Okay.
Professor, so in the address,
Jesus Christ, that was so
So-
long. Go ahead.
is our address the personal address?
When they ask you for billing address,
Yeah.
Uh-huh.
yes, that's your address. They're
Okay.
gonna, that's where they're gonna send you the certificate to.
Good evening. I
Hello.
logged in on my phone and then my phone went dead. So I made it home to log in. So I missed out on what we're doing right now.
So, do you have an NHA account?
A what?
NHA account.
NHA?
NHA, yes.
No.
Have you ever used that? Have you ever taken any other
No.
course, anything? Okay. So I'm gonna put it again in the on the chat, and I want you to follow that link and create an account with NHA.
Okay.
Now they're gonna ask you for some personal information, name, address, email, and then your actual address. I want you to put in the address, your actual address, because that's where they're gonna send you the certificate to.
Okay.
So I put it in the chat. You can follow the link.
Okay. Thank
It's
you.
gonna be a page. I don't know if you can see. Can you see my screen?
Hold on. Let me go back to the Zoom because I clicked on the link. So yes,
Okay.
that's what
So
it took me to.
it's gonna take you to that. Go to where it says create account. I'm gonna click it so you can see, and then first name, email, and then here billing address. Make sure that you put your correct mailing address.
Got it.
Good evening. Quick question.
Hello.
Do we use the Miami-Dade County the college email, or can I use my
Yes.
personal email?
Do you have access to the Miami-Dade College email?
Other question, teacher.
No. Can I just use my personal?
In your case, use the personal one because I know you have. That's why I asked you.
Right.
You have problems
Okay.
and forever.
Other question. Expect exam date. What day?
8/5, 8/5, 8/12 is whatever. That is not specific date, but you could put 8/5.
5.
That's what we have ours kind of scheduled.
Okay.
And for the ones I just got here, make sure that you, when it asks you, are you registering individually or with a school or training center? Pick school or training center, and then look for Hialeah MDC campus.
Yeah, I don't know if I'm done. It took me to, it says, welcome, Martha, get
Yep.
started, enroll in your course, apply for your exam.
You're absolutely done.
Okay.
Excellent. So next, our next thing will be to go back in to select the exam whenever the exam is available. So they're gonna put the exam on the website, and you'll be able to register for it. So that's kind of our next thing. But today, I just want to make sure that all of you have the account. So you're one more step closer to the end. That's kind of cool.
I create my account.
Okay, Christian, you've done too. Excellent. Anybody else? I got Christian and Mirta so far. Marta, Andrea.
I'm sorry, for the campus you said to put Hialeah, correct?
Hialeah MDC campus.
Okay, thank you.
Remember, it's specific to a campus because when you register for the exam, each campus will have a specific code they're gonna give you. So there's a code for each one of you guys, and it's linked to the campus. Yeah. Anybody else? Let's see what else was going on.
Okay. Give me a second. I'm just getting my computer. One moment.
Okay, so if it's Lane, Jaili, who else? Amika, Frank. Just let me know when you're done.
Teacher, no hemos podido entrar. Tenemos problemas con el email de Miami Dade College, parece. Estamos intentando. Jaili y yo.
Pero, ¿por qué el problema con el email? ¿Cómo ves?
I don't know. No nos acepta. Vamos a tratar nuevamente la información.
Okay. Me avisa si necesitan algo. Monique, waiting on date 8/5. It's a date that we that we said. So 8/5 will be the date.
Okay.
It could be 8/12, but it really doesn't matter. It's they're asking you, but it's not anything definitive. The day that we select the exam, if 8/5 is there, then that's the day that the exam has to be.
Once I'm done with the profile, what's next?
That's it. When it says welcome, then you're done.
Okay.
Are you done?
Yeah, I'm done.
Okay, excellent. Okay, so Vanessa and Kamika.
I'm almost finished. I was just double checking because
That's okay.
I just put Miami-Dade College because it didn't ask for a specific campus. It just said college.
It has to be Hialeah.
So do I type in Hialeah?
Yep.
You talking about for organization?
Mm-hmm.
Okay.
And if any one of you selected anything else that is not Hialeah, we need to go back, edit that profile, and select Hialeah.
So, it should say Hialeah Campus, MDC.
Correct.
Okay. I'm done.
Who's that? Who was that?
Oh.
Oh, Kamika. Okay. Okay, so let me start.
I'm almost there, guys. Give me a second.
No problem.
Professor, can you ping the link into the chat again, please?
No.
Thank you.
Okay, let me check again. So Andrea has it, Christian has it, Frank is checking. Lane is done. Kamika done. Martha done. Monique done. Rita's done. Vanessa's doing it, and Jiley's done. Okay.
I'm at the part that say type of organization. Is it a school or training center, right?
School training center, and then start typing Hialeah.
It said please enter 2 or more characters.
Yeah. So put Hialeah MDC campus.
Okay.
Teacher, la fecha del examen.
8/5.
And Professor, where it asks for expected date, the exam date, we put August 5th?
Yes, sir. I mean, yes, ma'am. Just say yes, sir, to Frank. Yes, ma'am.
Okay, I think I'm in. It said welcome, Vanessa. I'm
There you
in,
go.
right?
Then you are done.
Then I'm supposed to receive an email as well?
Yeah, you'll start receiving emails from them a lot.
Okay.
Also, when your certification is up for renewal, I think 6 months before it's is up for renewal, they'll start sending you emails to remind you to renew. So all of you should be looking into whenever you see those emails. Start thinking that you have to go out into the NHA, do 10 credits of continuing education, and then pay for the renewal. So the renewal is 100 and something. I want to say like 100 and could be like 110, it's probably 150 now. And you have to do 10 continuing education credits. So super simple to do. It just takes kind of a while to do. Somebody else here? So my suggestion is don't let it don't let it expire.
So before I get expired, how early you said we can renew it?
I think it expires every 2 years, so it lasts for 2 years. So like in around 18 months, you're gonna start getting emails to renew. So it's NHS gonna say, hey, your thing is up for renewal, and then they start telling you how to do it, what to do. Just get the continuing education credits with them. So it's super simple. But if you let it expire, and a long time pass after it expired, you have to take exams again. The same exam that you took, you have to take it again. Maybe you're taking the new exam. So it's it's better if you don't let it expire.
I should have done the registration with my personal email instead of doing with the school email because I check
Yeah,
that more often.
you have to do it with the email. You have to do it with the school email, and then you can change it afterwards. Because the school is gonna pay for the exam, so we have to make sure that we verify who you are. So
okay, it would allow us change it to the personal afterwards when we're done.
Correct.
Okay.
and I suggest you do it after you finish, take the exam and everything. Then you change it to that. So it's up to date. Okay, perfect. So Jaile's in. I'm gonna take all of you as you were in now. Perfect. So this is Frank. You're good.
Yes, teacher. We finished. Done.
Okay, perfect. Thank you. Perfect. So now everyone has it. Who I'm missing? I'm missing anyone here?
Teacher, Frank Jr. doesn't arrive yet.
Yeah, but I'm gonna say that you know how to do it, so he'll do it that way too, right?
Okay, thank you.
Okay, so that's it. So we good. I'm gonna say I think there's only one. There's somebody else missing. So this girl's name. Oh, whenever she's yes. Excellent. So everyone has it. Now everyone will be able to register for the exam. When the exam is available, I'll let you know when it is. Or someone from the campus from administration is going to call you or email you to do it. So the thing is that when they say, hey, you need to do the NHA account, you say it's done already. When they say, but you have to do it with the Hialeah, you say it's done already. And then we are ready. Okay. So let's go over the modules again. Let's finish now. Let's go back to the modules. This is module number 3. It has to do with coding and coding guidelines. This one talks a lot on ICD, CPT, HCPCS, modifiers, stuff like that. I think you are really good at looking for codes, or at least fast enough that I will be okay. I have another group that is almost finishing from another campus, and they're getting exactly the same thing that you're getting. And one of the students paid for the study guide and for the practice exams, and she said that she finished the first exam in less than 50 minutes. And she looked for the codes and everything, and she did the whole thing in less than 50 minutes. So you have 3 hours to do it. She did it in less than an hour, let's say then. She still had 2 hours to spare. So, and this is someone that's taking exactly the same class that you are taking with me and everything the same way. So I expect you guys to do the same thing. She was kind of scared that she wouldn't have time to look for the codes, and she said that she had plenty of time to do it. So I expect kind of the same thing from you guys. So let's talk about coding and coding guidelines. Again, all of these things are a review. So most of these things you've heard many, many times. So just again, follow, pay attention. Like always, we're gonna go through the objectives here. The objectives for this section is to have the how to take out the information from the clinical documents, and how are we gonna compare that or make it into codes. The code that we're gonna use is the ICD. For the diagnosis codes, they need to be to the highest level of specificity. We have the HCPCS and the CPT. Again, same thing, highest level of specificity, and they're gonna be coming from the medical record. We need to know when to use modifiers, or if we need to use modifiers, and then apply them to the actual codes. We are going to talk about what evaluation management are, and remember, those are the 99 codes. And again, level of specificity also really important. 99 is 2, 0 or 1 for new or established, and then 1 through 5 to make it specific. Or if it's in the hospital, it's a little bit different, but still, you know how to get them. You should know how to follow the numbers and get them from the book. And then review some procedures and codes that are different, so they all might require some clarification. The definition for medical coding is a process of abstracting diagnosis, procedures, and services from medical records and converting them into numeric or alphanumeric codes for claim submission. So coding means something was done, they put it in the medical record, and we need to now get that from the medical record and make it into a code. The process has changed a lot in many from many years ago, because you have to actually go to the medical record and get the information by reading what was done. Now we have software that is going to be work at the same time as the clinical aspect of it. So whenever the doctor decides to put a diagnosis, they're gonna think about the diagnosis in the medical coding way already. So they're gonna put it in the ICD, and then what they're gonna do is gonna be in a list, and that's gonna be a CPT. So you don't have to actually abstract that information. The information is gonna be given to you guys. But it says for claim submission, and claim submission, the other important word here is reimbursement for payment. For that, we're gonna use codes ICD-10-CM and CPT and HCPCS. ICD-10-CM stands for International Classification of Disease. 10th revision, clinical modifications. The part of clinical modifications is the part that has to do with the US. Everything else has to do with the International Classification of Disease. So ICD-10 is what we use all over the world. It's international, not all over the world, but in many places around the world, they use the ICD-10. In the US, we take that ICD-10 and we change or make it into something that works for us for payment, and that's the clinical modifications. So it's for disease, injuries, or conditions. CPT is a current procedure terminology. Those are codes for services and procedures. And if you remember, we have the HCPCS. HCPCS is anything that is not a procedure or a service. Actually, it's not a procedure. It's a thing, okay? And again, you remember HCPCS are things that you give to the patient, or things that are that you can buy, for example. Most of those things are HCPCS. Procedures done by a doctor, CPT. So, for example, a procedure it's an X-ray. A procedure is anesthesia, evaluation and measurement, a surgery. But an ambulance ride is not performed by a provider. It's not performed by a doctor, right? Unless a doctor was riding the ambulance. So that will be a HCPCS. If I give you a wheelchair, then that wheelchair, it's a thing. So it's also a HCPCS. You need to understand that many codes have to be together. It's called the linking of the procedures. So ICD and CPT codes have to be linked together in order for them to be paid. If there's incorrect linking of those procedures and diagnosis, then no payment is going to be sent to the provider. Wait, lost one here. Okay. The next thing is when it says abstracting health information, we're going to get that information from the electronic health record. And again, here's where we already talked about this, but here's where I have a problem with the consistency in the NHA, for example. On the first module, second module, they talk about electronic health records as being the whole thing that includes medical records from different providers, right? Here, they're saying the same thing. A digital version of the patient chart include documented by multiple providers at different facilities. Now, that's the picture. Why is that picture came out? I don't want to see that picture. Right? Okay. But the provider does not document the patient encounter in the electronic health record. They document the encounter in the medical record, so in the electronic medical record. Each provider will make it into the medical record, and then all those medical records are going to be compiled together, forming the electronic health record. So it's a little bit of discrepancy on what they are saying, but for all intents and purposes, electronic health records and medical records are the same when we're not talking about what's the difference between the two. Now, CPT codes or HCPCS codes are going to be, like I said, linked to an ICD, linked to a diagnosis. And at that point, we're going to talk about what is medically necessary or medical necessity of that patient. So the process of providing diagnosis codes that support the services rendered to the patient coding for medical necessity involves associating applicable diagnosis codes to services or procedures, codes within the billing software, which is referred as linking or linkage. So if I have I always do the same example. I have a broken leg. I'm okay with having an X-ray. Broken leg, X-ray. Or something happened in the leg, you get an X-ray to see what's happening. But that's not the same if you say that the patient is pregnant, for example, and then you say pregnancy, X-ray. Well, those two things don't go with each other. Just because you're pregnant, that doesn't mean that you are going to get an X-ray. Actually, it's not supposed to happen. So those two codes don't match. But X-ray and broken leg or fracture, they go with each other. So that is a good link that will work. Many of the softwares are going to have things that make sure that you don't get those linkage wrong. So most of the time when we're talking about this, we're talking about payment, but also you need to understand that you need to follow the standards for CMS, and so that's Medicare services, Medicare, Medicaid services, and also the Office of the Inspector General. So if you do not do the linkage properly, then they might suspect fraud or abuse. So we have Billy here with a perfect example, documentation of patients, so patient record, chief complaint, the patient fell, so fall with a scraped skin on elbow and hip pain. History of perceived illness, the patient presented to the office with an abrasion of the left upper arm. I thought I said, hip pain. Presented with an abrasion of the left upper arm from a fall 2 days ago in the driveway. Patient also reports left hip pain that began yesterday. Patient described the hip pain as dropping and is an 8 out of 10 on a scale. And then, so what is it that the patient has? Well, the patient has an abrasion, left upper arm, and left hip pain. And then the plan, keep the area clean and dry, cover with a clean dressing daily until healed, and ibuprofen every 4 hours as needed. For pain, left hip x-ray to rule out fracture. So that's kind of the description. This is what you're getting. So from here, you're gonna get what is it the patient has. So an abrasion and where, pain and where, and what are we gonna do? Well, in this case, we said to kind of do nothing here, prescription here, and then the important part here, left hip x-ray. That makes sense. Left hip pain, a left hip x-ray to rule out fracture. For that, we are talking about, in this case, was the assessment and the plan. So that is a type of notes that we have in doctor's offices. So we talk about what happened in this way. So we call it the SOAP format. SOAP, SOAP, subjective, objective, assessment, and plan. So whenever we're writing a doctor's note in many of the doctor's offices, they use this type of format. Subjective means what do the patient has in a subjective manner. So what the patient says in their own words. Pain, for example, is subjective. It's something that you cannot measure. So the patient says it hurts. That is subjective. Objective is vital signs, things that you can measure, things that you can see, findings. So if you see that the patient says that they have pain in their elbow, that is subjective. But if you see that they have an abrasion in their elbow, then you know that is that you can see it, that it's a finding, that is objective. Assessment is the diagnosis. So whenever you're looking for a diagnosis, you're looking for assessment. There you're gonna find the diagnosis or the working diagnosis based on the subjective and objective findings. And then at the end, you're gonna have a plan. A plan is a procedure or plan for treatment, including treatment frequency, duration, expected outcomes. The plan often includes medication referrals or patient education and counseling. So if you are to see an example like this in your exam, they're gonna say, okay, this is what happened. Give me the CPT, for example, for the plan. In the plan, the CPT will be the left hip X-ray. This is an example. It will be a lot more specific in the exam, but that's good. If they say, give me the diagnosis of the ICD, then you have an abrasion and wear, and then you have pain and wear. That's kind of what you're supposed to get. And you get it from subjective, objective, assessment, and plan. Subjective is going to have symptoms, things that are non-measurable. Pain is the quintessential example of something that is subjective. Pain. Objective. Patient has okay, let's do temperature. So the patient comes in, okay, and says, I feel hot, like I have a fever. Okay, I feel like, that means that the patient is telling the symptoms. I feel warm. Okay, that is subjective. I feel warm. Then objective will be the vital signs. So now you take the patient's temperature, it's 100.4. Okay, so 100.4, the patient has vital signs, or in this case, it's a sign that is objective. If any of you go and check the patient, that's going to be the vital sign that you're going to get back. Assessment, the patient has a fever. So the fever is the diagnosis. So fever will be diagnosis, it's going to be under assessment. The actual value of the temperature, 100.4, will be objective, and subjective will be that the patient feels warm. And then the plan, medications or whatever we plan to do. Now, clinical documentation is really important to what you're going to do, because that is the information recorded in the medical record pertaining to the health status of the patient determined by a healthcare provider. So the clinical documentation is not what the patient feels, is what the doctor is actually saying and putting down as what it is. That comes from history and physical information pertaining to the patient's health and history and current condition. Progress notes, this is the encounters, history, exam, medical decision making, just like in the sub notes. Consultation reports, if it's in a inpatient setting. Orders or plans, requests for services, lab, diagnostic tests, medication, whatever it is, those could follow CPT codes. Operative reports is the surgeon dictated report that contains the details about the procedure performed, so what happened during the surgery. Radiology, nuclear medicine reports, so it's after they took the X-ray or whatever it is, then someone has to read it and give the impression. If the patient is admitted, then discharge summary is information on what happened during the inpatient stay for that patient at the hospital. For your sake, everything is done through software in computers. So they're gonna have different type of features. Even the free ones have every single thing that you need in order to run a doctor's office. The most expensive ones are just tailored to the facility. For example, places like small doctor's offices use free or really inexpensive software that works perfectly fine. And a big hospital, like for example Baptist or the Baptist Health System, is gonna use a software that was made for Baptist. It's a lot more expensive, but again, both of them will end up doing the same thing. We talked about this No, I did not talk to you. This is the other class. There's an example here that says that type 2 diabetes is E11 includes diabetes due to insulin secretory effect, not other ways specified, insulin resistant diabetes. And then if you are going to use insulin or any other medication, you're going to include code for C codes. So just know, again, this is how you look in the book. Excludes, you cannot use any of those. This is another type of diabetes. It's another type of diabetes. So if you see E11.0, type 2 diabetes with something, if you see it 00, it's without that. And then if you see E11.01, type 2 diabetes made us with and with something else. So that's the way that you follow, and you already know how to do this. Because they start with E, or because they start with a letter, so alphanumeric, you know that that's a ICD-10 code. And if you see that they start with numbers and they are 5 digits long without the dot in the middle, then for sure they are CPT codes. Example of CPT code here, that we've seen this before. 11000, debridement of an extensive area of infected skin, 10% body surface area, and then more for each additional 10%, you have an add-on code 11001. Remember, an add-on code you cannot use as a primary. You have to use it in combination with something else. So that plus sign means that you have to have the other code first and then this added. So if the patient had anything beyond 10%, so between 11% and 20%, then you will use one of the add-on code. If you have 21 to 30, then you will have to use 2 of these add-on codes. There's a list of what we call abbreviations or acronyms that we are going to use. Others are the ones that we are not going to use. So this is called the Joint Commission's Do Not Use list, or part of it. U, like a capital U or lowercase u for unit. It might look like a 0 if you do it really fast. It could look like a 4. It could look like a CC. So instead of putting U for unit, please write unit, the whole word. IU is in international unit, kind of has the same mistake. You can, if it's written down manually, it could look like IV, or it could look like the number 10. So whenever you're writing something, or not use some of the people that need to write things, make sure that you know what their intent was. So if it's to write IU, then write international units. Q, D, Q, like all those that are for every day, every other day, they could be mistaken for each other. So just write the whole word, daily or every other day. Anything that has 0 or anything that has a decimal, you could put the decimal point wrong. So make sure you write it properly, so without the 0 after, or if it has a leading 0, put it there. MS for MSG, O4, so that's a bunch of other things. Morphine, sulfate, magnesium sulfate. So you can get them wrong, so write the whole thing. And this is not for you guys, this is for the people that are going to write the things for you or with you. So you need to know what is the Joint Commission's do not use list, so they know how to write things properly. And this could be handwritten things or type. So to make things easier, the HIPAA administrative simplification portion decided to use a code set. The codes that we use are going to be, like we said, the ICD-10. That includes both ICD-10-TM for diagnosis codes and PCS for the inpatient procedure codes. CPT for outpatient services and procedures. HCPCS for things that are not CPT, or services that are not included in the CPT. CDT for dental procedures, and then NDC for drug products. Listen, this question is going to be on your exam, okay? Or not the question. A question that the answer is going to be CPT. It's going to have CDT as an option. And I show you that in the terminology that I gave you at the beginning of class for you to study. That's a distractor, okay? So they're gonna have a question about how do you code for procedures, and it's the options are gonna be ICD, CPT, HCPCS, and CDT. Again, that is a distractor, okay? If you see dental, get away from it. That is a distractor. Don't answer dental procedure in your exam. That's a distractor. United States, usually the HCPCS level 1 or level 2 national codes. So those are what we call the CPT and the HCPCS, completely separated, and then the ICD-10-CM or PCS. We are going to use them for procedures and for diagnosis. Know that they are used for payment, so the method reflects the traditional fee-for-service model. So if you get them properly together, you'll be fine. If they are completely not linkable, then no payment. So let's talk about the different types of codes. The CPT is published annually by the American Medical Association, and it's to code for services performed by a provider. Okay, so medical, surgical, diagnosis, anesthesia, or medical. The format is going to be 6 sections for the category 1. They are the most common used ones. They are numeric, so they are the codes are gonna be 5 digits, all numbers. The CPT code, again, we said it's gonna be published annually, and it will begin January 1st. So a couple of months before, they'll send you the new things. You don't need a new book. You just need the what changed. So if you're using the 2023 book, right? That's what you're using. Yep, you have the CPT 2023 book. Then at the end of the year, you don't have to buy a new book. You just get what were the changes, and you just look at the changes. If the changes apply to you, change it in your software. If they don't, then there's nothing for you to do. In the CPT code, we have category 1, 2, and 3. 1 is the one that we always use. Category 2 is for tracking and performance, and 3 is for emerging technology. So the new things are gonna be there for a couple of years, and they can move to the actual CPT book or not, and they're gonna be deleted. To keep it super simple, the first section is the 99 codes. It's evaluation and management. Second section is anesthesia, starting with 00, ends with 01999. And then surgery is the largest section. It's divided into all these sections. So it's going to be from the 1 to the 6. So from 10004 to 69990. So that's another way that you can remember it. If it's a 1 or a 6, it's going to be in surgery. And then the surgery is going to be divided for areas: integumentary system, skin and fat, nails and hair, musculoskeletal, respiratory, cardiovascular, digestive, urinary, male and female, nervous, and then eye, auditory, and any annex. 7 are going to be radiology. 8 and a few 0 is going to be pathology and lab, and 9 to a few of the 99s is going to be medicine. So I always say that the 99 codes or the evaluation and management codes are going to be all 99s, but some of the 99 codes are going to be medicine. So when you see a 99 code, look for it in either the medicine section or the evaluation and management. If it's something about, well, someone went to the office and it explains like a visit, then it's going to be an evaluation and management. If he explains anything else that does not sound like a visit, it's going to be under medicine. You have a few other sections or category 2 codes. They end up with letters, so they're going to be alphanumeric, 5-digit alphanumeric. Those are going to be category 2. And then also category 3, are going to be alphanumeric also. So 4 numbers and 1 letter at the end. Again, don't confuse them with the HICPICs that are going to start with a letter and then have 5 digits. The last 4 digits are going to be numbers. And then you have Appendix A for modifiers and everything else. So all the modifiers, you have them in the appendix with all the explanation, but what you need, it's going to be in the cover of the book. Symbols also on the cover of the book, you're gonna find the symbols. I'm not gonna go over the symbols again, but just if you get a question, it's gonna say, hey, what is a revised code? And they will have this for. Okay, and then you say, oh, revised code is a triangle. So you have to memorize it. No, get it from the book, know where it is in the book, and you shouldn't have a problem. Coding here, CPT coding for minor conventions. Parenthetical notes can contain information about deleted code, cross-reference, and specific coding. Example 10.160, puncture aspiration of abscess, hematoma, bulla, or cyst. If imaging guiding is performed, see this. So it's telling you that it's a puncture aspiration, so they're poking it and removing the abscess. But if it has imaging, then you have to go to this section. So it's telling you if it's only the puncture is this one. If it's puncture with imaging guidance, go to here. And again, you probably are really good at this. In your exam, it will look something like this. So imagine the question says add-on code. What is the symbol? Forget all this 3 here. Add-on code. Oh, here you go. The plus sign. Or it will be the opposite. It will show you this 4 or any of these 4 symbols, and then it will ask you. These are going to be the options. So it can show you either way. Anyone has a question? I can hear. No, again. Okay. So like you said, each section is a group by system. And again, this is the best way to see it is like this. If we're talking about sections here, then you can know where you're supposed to look and then go to that number. It's easier if you go through the index and then go to the actual number without knowing this. But just know that this could be a question. What are the different sections of surgery in the ICD? The medical terminology, again, I talked about medical terminology in a few ways, meaning that you might need to know just, super basic anatomy. If you don't know it, just follow the index. The index will tell you, actually take you to where you're supposed to. So you're gonna learn a lot as you end up working at a place that does the same thing over and over again. So memorizing everything else is not needed for you guys. So medical terminology is important, but if you can see it, you don't know what it is, but you can actually figure it out by looking at the word and looking at it in the index. But you still have to be really, really attentive to detail. For example, here, oophorectomy, They sound kind of the same. They just have like 1 or 2 letters that are different, but they mean completely different things. Hysterectomy, hysterotomy, again, sound kind of the same. They are written almost the same. There's like 2 letters here and 1 letter here that change, and that means something completely different. So attention to detail, because most things are super specific. When we get to the evaluation and management codes, you need to know what place of service. That's also in your book, in the cover of your book. What is the explanation of what is place of service? So place of service will be outpatient services, hospital, nursing facilities, and it will tell you what code, what number to use in the CMS 1500 form for it. Type of service: consultation, non-face-to-face, newborn care service. That will be also important when you're getting the codes. The other thing is patient being new or established. So if a patient is new, what is the definition of a new patient? If a patient is established, what is the definition of an established patient? Inpatient, what is the definition? Outpatient, what is the definition? So let's try real quick. New patient is a patient that has never gone to that office or to that provider ever. Excellent. New patient will be a patient that has been at that office or that provider, but there's a gap of more than 3 years. An established patient will be someone that has been there before and has not have a gap of more than 3 years with that provider. Inpatient is someone that has to be admitted to the hospital. It's in a 24-hour basis. So if someone goes to the hospital and stays 24 hours or more in the hospital, immediately they will be admitted. So an admission to the hospital is what makes you an inpatient. Outpatient, anything that is not an admission and that is less than 24 hours. In order to know what how complicated things are, you need to see how history is going to be. History could be detail. It could be really mild. It could be like nothing. Chief complaint and history of personal illness, and that's about it. Or it could be a really detailed back and forth with what happened to now, to history, your family history. The examination, kind of the same thing. If it's something specific, then you're gonna look at one area. If it's something that requires multiple things, multiple organs and systems, then it will be more complicated. And then the medical decision making, is it gonna be straightforward or is it gonna be really complicated? If the history is extensive, if the examination is broad, if the medical decision making is really complicated, then that is the thing that's gonna take more time. That's the thing that is gonna pay the most. Now, ICD-10, International Classification of Disease, was developed in the World Health Organization, or the WHO, in 1948. It's a global classification system. It's being used for many years in the United States. We do our clinical modifications and our procedure coding system just to implement it in what we do and the way we do it. The ICD-10 or the ICD, it's published by the WHO or developed by the WHO. The publish for ours is maintained by CMS, so Centers for Medicare Services, and they update it annually, even though the ICD-10 or the ICD does not update fairly often. Usually is around 10 to 15 years every time a new one comes. ICD-9 was used for around 30 years, around the 80s to the 2010s. And then from 2012, 14, around that time, we started using ICD-10. So you expect it to be here for probably like 10 more years around that time. So they are maintained by both the WHO and CMS. We are the only place in the world that uses that for reimbursement. So I think there's somebody else, can't remember now, in Europe that is using it for reimbursement, but we are the only ones, or the main ones, that use it for reimbursement. So we compare the CPT and the ICD, and we link them together. Not many other places do it that way. The ICD is divided into chapters. The chapters are going to be labeled by letters. So A and B are going to be number 1. Number 2 is going to be C and D, the half of D. 3 is going to be the remainder of that D. So you can memorize it like that if you want to. But E's are going to be 4, F 5, G 6, and we're going to go all the way to C. And then we have U's are a little bit separated. So we have 22 chapters, each one divided into a specific thing. Certain infectious disease, neoplasms are going to be on tables, disease for the blood and forming organs. That's where you're going to find blood cancer, stuff like that, endocrine for diabetes, nervous system, and then you go all the way down. The range is going to be between, in this case, A's and B's. So it starts A00. Remember, the code could be just 3 digits. Okay, some codes are only 3 digits long. Alphanumeric. First is going to be a letter, and then 2 numbers. That could be your code. Some codes, like in fractures, could be 7 digits long. So not all the codes are going to be 6, 7 digits. There could be 3, there could be 4, there could be 5. And again, simplest way, go to the why same index? What index? Go to the index. Find the word. Go to the chapter. Look for the code and get it as specific as possible. So there's different sections for each chapter. Again, just know what everything means and what goes first, what goes second. So if it says something like code first or use additional code, that means that you have to code that other code first and then use additional code if it has something else. Some of them are going to have what we have seen in the past, code, and then it will say something with or without something. So if it's with something, then usually you code that first, and then you could use another code for the next thing. Now, this is going to be as specific as possible. We already worked on this. Left, right, open, close, any of those things are important. Now, here we have Billy. Billy's gonna give you a tip, and he says the number 1 rule of using the ICD-10-CM coding manual for accurate coding is always find the main term in the alphabetical index first. Okay, you can think that you know a lot of medical terminology and then you understand the book. That will, if you don't have, if you're not doing the exam, that's okay. You have all the time in the world. But in the exam, you have to do it as fast as possible. So you go to the index, you find the code, then you go to the code in the book, in the chapters, and then go find the code and usually start looking for what is more specific. So in the table, whenever you get in the code has the numbers and it's labeled down. So that's the tabular section. Confirm the code before assigning the code. So before you select the code on the exam, make sure that you went to the index, you found a code in the index. Even if it's one code, always go back to the book, go to the chapter, tabular list, and find it there. Okay. An example of a code here, of course, they put one that has 7 digits. This is ICD-10-CM. The code is 40.021A is contusion of the right upper arm, initial encounter. So remember, alphanumeric, it could have numbers or letters. The first one is always an alpha, it's always a letter. The second one could be, it's always going to be numeric, only numbers. And then from there all the way to the end, they're going to be alpha numeric, 0, 0, 1, 2, or it could be an X as a placeholder, X, placeholder, placeholder. And the last one is going to be an alpha, a letter, and that's a 7 character, the one that is always in a pink box on top of the main code here, S40. So if you get to S40021 and it says that you need a 7 character, you have to go to S40, and before S40 you're gonna have a little box that was gonna have the letters, and that's the extension. It's gonna tell you initial encounter, open fracture, initial encounter for closed fracture, type 1, 2, 3, whatever it is. Same thing here. I do not care how much anatomy you know. I just care that you follow the information. If it says something that malignant neoplasm of upper third of esophagus, we're telling you that you have the patient has cancer in the esophagus. Cancer in the esophagus is C15. When you go in the list, you go to the different parts of the esophagus in this case. Upper third, middle third, lower third, overlapping sides, or unspecified. Remember, unspecified, unless they ask you for the unspecified, never select or try not to select a code that ends in 9, because that means that it's not specific enough. Same thing here. You have 6 digits, and this is going to tell you acyclovir. It's a antiviral medication, adverse effect of it, and then it's going to tell you it needs a 7 character, and then A, D, or S are the 3 options: initial encounter, subsequent encounter, or sequela. Something like this could happen. You have acute pancreatitis or chronic pancreatitis. So if it tells you acute, is this one? Chronic, is this one? And then look that the numbers are kind of close, but not necessarily. So you have to go always forward and back just in case. Influenza here, non-otherwise specified, is J11.1. But if it's specified with something else, then it's 81, 82, or 83. So I think you're good at looking for codes. So I don't, I don't want to kind of go through the rules again. I think what should be required is a little bit more practice, and we're gonna do that next class. The ICD-10-CM uses a placeholder X just in case you need to put a spot. So for example, you have T67.7 that has 4 characters, and you might have a 7 next to it. That means that it needs a 7 character. You go to the 7 character and you said that it's an A for initial encounter, but then digits 5 and 6 you don't have, so you put 2 X's for it. I'm going to show you how to do that also. We're going to practice again when we do that tomorrow. Now, when we get to HCPCS level 2, HCPCS are things that are not procedures. So outpatient, things like products, supplies, or services that are not included into the CPT code. Again, if it's not done by a doctor, or a medical assistant, or a CNA, or a nurse, it's probably an HCPCS. If it's a product, it's probably a HCPCS. So the example of things that you might need to use both. So in some places you're gonna use Medicare. So if it says Medicare, then you just do annual wellness visit. For Medicare patients, it's gonna be a HCPCS. And if it's for a commercial payer, it's gonna be one of these. So those are things that you're gonna learn as as you as you after you actually are working. Depends on who you're billing for and what do they do. So HIGBICs are gonna be divided into codes A, B, C, all the way to V codes, and they're gonna have their specific thing. So HIGBICs are super simple to look for. We practice that really fast. They are specific, they're short, they're simple to understand, and they just start with a letter, and then you can just follow that letter and get it really fast. Example of, and we did this one, intramuscular administration of a medication. That's the actual code for it. And if it was oral medication, that will be it. If it's that plus the medication, then you're gonna have that one and the name of the medication next to it. So that's also an important one. Some will have the dose next to it. So J1050, 1 milligram. But if you have more milligrams, then you will have to use that one more than once. Or you could use different ones if they have uh, uh, different values. All of this information is there. You just have to read it. Uh, and again, as you're looking for the code and understand what it is. Next thing that we need to understand is modifiers. We've been through the modifiers multiple times. I remember one day a long time ago when I went over each and every single one of them. I read all of them to you, I explained all of them, and I gave you examples of all of them. Now, I said that was a 1 or 2 time thing that we are going to do, just so you hear it, just so you ever remember that you needed something, where to get it. Modifiers are gonna be in the books. So you look for your books, you know where the modifiers are, and you read the modifier, and you read the number of the modifier, and that will tell you what it is. Okay, that's usually what you need to know. In the exam, they're gonna say modifier 23 means what, and they're gonna put you 3, 4 examples. Then you go options, and you pick the correct option. You don't need to memorize them. You just need to know where they are. So when they ask you one, you can go and get it immediately. There's some that are gonna be numeric. Some are gonna be alpha. Some are gonna be alphanumeric. Usually, the ones that have alpha, or the ones that have letters, they are going to be description of anatomical areas. It will tell you specifically where something is done. LT, RT, left and right is a perfect example of that. And again, here you go, a few examples of modifiers. I do not care if you memorize them. Just if I ask you what is 50, bilateral. What is 80, assistant surgeon. What is 99, multiple modifiers. What is 57, decision for surgery. What is distinct procedure service modifier, 59. So that's it. You need to know where they are and get it. They're not gonna make you use them. They're only gonna ask what they are. Okay. And they show you something like this: evaluation and management encounter 99213, modifier 25. So modifier 25, we have it here. Significant separately identified evaluation and management service by the same provider on the same date of the procedure or service. So that means that we did all these things, but also we did an encounter for something else. So again, it's really important that you know that whenever you do one thing, then you're gonna be paid by that thing. That modifier is going to either, again, change the payment for more or for less. Okay, so in this case, we want all of this to get paid plus the evaluation and management also. So we're saying, hey, this is separate from the other 2 things that we did. So pay me more. But sometimes is something like this, 53, discontinued procedure. So if the procedure was not completed, then you're saying, hey, we didn't finish the procedure, and that point, modifier 53 is going to pay less. It's going to modify the payment for a lesser payment. So any of the ways it's going to work. correct coding, specialty payer-specific coding issues. So, what is the thing that I tell you 100 million times? No two patients are going to be the same. No two insurance are going to be the same. No two providers are going to be the same. So, whenever you have a patient that has one insurance and that doctor is participating on that insurance, and then you were working for another doctor, just because they have the same specialty and the same insurance, that doesn't mean that they pay the same. Because a patient has the same insurance as somebody else, that doesn't mean that they're going to pay the same. Insurances have different lines of business. One example that is super simple for you guys to remember is United Healthcare. United Healthcare has gold, silver, and bronze plans for their commercial or private insurances. They have the marketplace, that's the one for Obamacare, and then they have Medicare, Medicaid, and they have group insurances also as HMOs for Medicare, Medicaid. So basically, if you say I have United Healthcare, you could have United Medicare, Medicaid, you could have Marketplace, you could have Gold, Silver, or Bronze. You have 6 types of insurances embedded in United Healthcare. Now, doctors are going to have different contract with those insurances, and they will pay at a specific rate, and maybe they only have the Medicare, or maybe only the Medicaid, or maybe only the private ones. So you participate in whatever section of that insurance you agree to and do the contract, and the payments are going to be completely different. So a patient that is seen for 99,213 with a different insurance than somebody else is going to pay different. So all those payments are going to be completely different. So that means that every single patient and every single combination of patient insurance and provider will require you to do some math on the payments. Okay, so remember that. Every single combination of patient, provider, and insurance is going to require its own math, its own computation. Now, having said that, it's not okay to try to make everything even. You're like, well, if you pay out of pocket, it's $100, but the insurance is gonna pay me $50. Let me figure out a way of getting $100 from something like that. So those things are illegal. They are unethical. They are wrong. They are bad. I don't know any other word for or bad, horrible, whatever it is. What can happen is that something that is bundled together, you unbundle it. Okay, surgical procedures will have, or CPTs will have, multiple things included. A surgery, for example, that is a global procedure, will have pre-op, surgery, and post-ops. And for 90 days after surgery, you cannot charge the patient again for following up on that surgery. So the follow-ups are up to 90 days. If you separate that and you say, okay, no, I'm gonna see the patient now for the surgery, and then I'm gonna charge them different visits at 1 month, 2 months, and 3 months, that is unbundled in the procedure. That is illegal. Okay, that is illegal, and that is something wrong. So you have to document an individual procedure if that's what you're supposed to do.
Question: does that only apply to if they have a surgery that they can't charge for follow up for 90 days, or
specific procedures will have specific it's called global period, or period that you cannot charge them again for.
Got it.
Little tiny procedures, injections, for examples. I think I mentioned it a long time ago, but an injection for, let's say you have extreme pain in a joint, and they give you a steroid injection, cortisol injection. For 10 days, you cannot charge the patient again. So if the patient comes back the next day with extreme pain in the injection site, that you cannot charge them again because it's considered part of those 10 days.
Got it. Okay.
So it could be 10 days, it could be 90 days. It depends on what it is. So it's not necessarily only surgeries, it's some procedures.
Okay.
The other option that you could have by changing things is upcoding or downcoding. So upcoding is reporting something higher than what it is for you to get more money. That is fraud because you're lying about it. Okay, you're saying that you did something that you didn't do, or you're saying that the patient has a specific illness that they don't have. The opposite to that is downcoding. Downcoding is when you say, you know what, I don't want to send all this documentation. This is gonna take forever. Let me code for something lesser because I know they will pay for that without asking a lot of questions. So that is easier to do. So again, that is also illegal because you're lying about it. The patient had something completely different to what you are um, saying. Those two things are, uh, three things are illegal, wrong, and they can get you in trouble. Query is a tool used to contacting the responsible provider to request clarification about documented diagnosis and procedures. This happens a lot. They will call from the insurance company, and the ones that are going to receive the insurance company phone call is you. And they'll say, "Oh, insurance." Let's send it to the biller. So the biller goes like, "Okay, so they're asking about this." So then you usually what you do is you send them a documentation of the visit, for example, to make sure that their things were done correctly. Many of the things that you're gonna do are gonna be specialists, so cardiologists, neurologists, orthopedic surgeons, and the nice thing about that is that you're gonna get really good at it. But in the meantime, you need to know about all of them in your for your exam. And again, we practice burns, we practice specific things with specific amounts of numbers like 10 to 19, 0 to 9, stuff like that. And you need to know that that is specific. Uh, X-rays, 2 views, 3 views, with something, without something. We've done most of them, not most of them, but a bunch of them. And again, it makes sense that you know that there are different specialties. So we went through almost every single chapter. At least we did 2 or 3 from every single chapter. We did a bunch of the fractures. Again, those are the hardest ones to code by far. But again, if you follow what it is, okay, torus fracture of the lower end of tibia, initially encounter closed fracture. The torus in this case is a specific name organ. So you can look for that, it will tell you where it is, and then initial encounter for closed fracture will be the 7 digits. So all of that thing, you get it first, and then you get me the last one. Again, simple. You know how to do it. You practice this. I do not foresee any problem with you guys doing that. Payer specific coding requirements. Just know that many different insurances are gonna be specific about the things and the measurements um, for you to actually give a diagnosis. You're gonna learn that little by little as you start practicing the field. Uh, and again, if you have a code for diabetes, and we're talking about the lab results here is going to be in category 2 CPT code for performance. ends with a letter, so that's how you know what that is. So we have one for someone that has hemoglobin A1C levels below 7%, between 7 and 8, between 8 or greater, like all of that specific, super specific. Um, so whenever they're asking you to get that, it will tell you specific where to go, and you will have to match those numbers. So some providers, including Medicare, are extremely specific about things like this. So you have to make sure that you get those correctly. Little summary here: medical coding translates narrative documentation for the providers into standardized code sets to build to third-party payers or insurance companies, and then the reimbursement is going to be based on the patient's policy. So patient's policy is gonna deal with the reimbursement that is going to be paid by the third-party payer to the provider. So again, the same thing that I was saying, all three parties are gonna be specific to each other, and they're gonna have specific payment, reimbursement, uh, and there will be uh, more uh, more things based on the insurance company than every other party. Code says that we use CPT, ICD, and HCPCS to report procedure services and supplies and diagnosis. Why is it diagnosis? Oh, there you go. Diagnosis, procedure, services, and supplies. Primary set codes include clinical concepts. Clinical concepts include medical terms, anatomy, physiology. Modifiers are applied to CPT and HCPCS codes to add information about payment. So modifiers are going to modify payment. They could increase payment or they can reduce payment. Example, if you do something bilateral, then you should get paid more than if you do it only one side. And if you did something halfway because the patient died in the middle of the surgery, then you should state that with a modifier so they pay less. Um, Providers can proactively identify and prevent billing coding mistakes by getting the information, reviewing the claims, because everything is associated with reimbursement, then again, the more specific code possible is required. And many of the information that you use could be used for quality measurements. So whenever you use CPT category 2, we're talking about using codes for statistics, quality measurement, and to see if we're doing things properly. I'm going to jump to the glossary that I like to do at the end. These are the same things that we saw in the middle of the module. So I'll have this for you guys. I'm trying to get it in a way that is simple to get. I might use Christian's idea to create a drive and just give you the link so you can access it. So because it's kind of too big for Canvas, or Canvas is just saying that they cannot do it. Hopefully, I'll be able to do that using Christian's idea. Go ahead.
Is it too lengthy to just do screenshots?
Um, I mean, I do screenshots. One of the things is that it's kind of illegal. We're not supposed to give it to you guys. Every time we open something, it says or right to serve. Things like.
Oh, so you're just trying to take the print itself.
I'm trying to help you out, give it to you guys, but then without getting
No,
in
I'm
trouble,
saying
or getting you in trouble.
right. So
I got you. Like you'll get it one way or another way. I'll figure out a way. I have it in a way that it's just a little bit too big because you have a bunch of pictures and things. So I might just have the the words and whatever.
right. Okay.
But again, that's something that's gonna help you a lot. But if you go back and let me see if I can show you, because this is something that I gave you. And this is me, making sure that you did good. You're gonna do good. I'm petty about this. Petty. Computer, hurry up. You go back to June 13. June 13, I sent you guys, and I put this on Canvas. June 13, 8:25. Look at that, almost exact time that we have now. I gave you this, and I told you, please go over it, read it, memorize it, something like that. 200 codes, 9 pages of information. And just really fast. I'm gonna go over a few of them. And that's all the exam is here except math and except the looking for the codes. Anything that they can ask you will be here. Okay? Processing, translation, transformation, encounter form, assignment of benefits, co-insurance, coordination of benefits.
That's the term. That is the billing and coding terminology review, right?
Yeah.
Do you say we need to be focusing on that one?
I think you should. This is something that is really. I have it also in kind of an exam form. I'm gonna give you that also for you to do. But